Yes, I'm ready, ma'am.
Okay, so if you've read and understood considering it communication skills station, please begin.
Okay. Hello, my name is Dr. Ala Abdullah. I'm a CT1. I'm surgical CT1 in London Royal Hospital. I'm calling to speak to the ITU registrar about a critical patient who will undergo an urgent laboratory. Am I speaking to Miss Dua?
Yes, doctor.
Okay.
Mhm.
Okay. I have a patient who has been admitted with sudden onset of abdominal pain. We did a history and examination, and the examination we have signs of peritonism, so we are suspecting a perforated viscous. In this case, this patient needs an aerial laparotomy, and with a background of COPD and using steroid, we think this patient may need an ITU admission after the operation. And he is also in a critical situation, and he has metabolic acidosis, hypokalemia, and acute onset renal failure. So I'm calling to ask you about advice about preoperative preparations and the possibility of admission after the operation.
Mm-hmm. Okay. Okay. What are you going to give to her? Are you going to give her oxygen?
Yes, we are going to give her oxygen as he is a critical patient, and we started ABCD approach for the patient. Yes.
Okay. You give her how ml per liter?
Yes, we started 15 liter per minute
Mm-hmm.
with an repressor mask. Yes, and we also have did a full checkup and did investigation for the patient. Now the patient is we did an ABE, and the patient has metabolic acidosis. She also has raised creatinine and urea levels. So we seen acute renal failure in this patient. We also have a hypokalemic picture of the patient on the blood samples. Yes.
Okay. You are calling me to that. You want and you need a bed for her. Am I right? Could you tell me why you need the bed for this patient?
Yes. There are two main reasons for this. First, the patient has COPD, so we are afraid of the post-operative complication with the respiratory compromise. So the patient will there's a chance that the patient may need mechanical ventilation after the operation. And the patient has multi-system organ failure. We have acute renal failure, and we have hypokalemia that needs to be managed with the ITU after the operation.
Okay.
Yes.
Okay. How to prepare this patient for the surgery?
Well, first I have to I need to correct the patient parameters. I will consult with the cardiologist about the hypokalemia, and I will do ECG, look for signs of hypokalemia. And I will follow the cardiologist's advice for correction of hypokalemia. And regarding the patient COPD, first I will check for any infections, and I will do an X-ray. I will also inform the anesthesiologist for intraoperative care, and I will prepare for post-operative chest physiotherapy, and I will optimize analgesia for the patient after this to ensure good ventilation function of the patient. Yes.
Mm-hmm.
And I also will inform the operations theater as the general surgeon. This patient has suspected perforated viscous, as we did an ultrasound, and we have seen a fluid collection. And in this case, urgent. Yes.
Okay. What about her hemoglobin level?
Yes, we have noticed a drop in the hemoglobin level of this patient.
Mm-hmm.
So
what,
we are. Yes.
what are you going to do for this?
Well, we will measure the
Who is talking in between?
hemoglobin level, and we check the need for blood transfusion. As the investigation we did a blood sample, grouping, and cross matching, and we prepared for units of blood collection. In case the patient hemoglobin dropped below to 8, we will give the patient
Okay. Who do you want to contact beside me?
Yes, I will first contact the anesthesiologist, and I will contact the general surgeon. I will also contact the cardiologist, and I will also seek advice from the chest physicians in this case, and also nephrology.
Okay. Are you going to give her antibiotic?
Well, in this case, we think this contaminated surgery, so we will surely give the patient antibiotic at induction of anesthesia, and will continue minimum of 2 days after that. And we will also be monitoring the patient CRP and ESR as inflammatory parameters and TBC. If any signs of sepsis appear, we will start sepsis 6 and we will take blood culture and stuff.
Okay. Okay. And you will keep her oxygen level between
Yes,
Mhm.
this patient is so with you, so we have to make sure that our oxygen level is between 88 and 89 to
Okay.
prevent.
Why you are doing this?
Sorry?
Why you are doing this? Why you are keeping her oxygen saturation between 22 to 88 and 92? We can increase this rate.
We shouldn't do that because the patient has COPD and she has a long history of hypercapnia. So decreasing in the level of the CO2 will decrease the respiratory drive for the patient. So we should
Okay.
keep the oxygen level between 88 and 92.
Okay. Okay. What about her fluid? You give her fluid?
Yes, we started resuscitation with crystalloid, and we insert a urinary catheter to measure the fluid balance. Yes, this patient needs more invasive monitoring of her fluid status, so she will benefit from central venous line to measure the central venous pressure. I will also keep monitoring her physiological parameters, including the pulse rate, respiratory, the pulse rate, the blood pressure, the capillary refill, the urine output, and the temperature of the extremities and her mental status.
Okay. Did you insert a urinary catheter for her?
Yes, we did.
Okay. Okay.
You said patient is case of COPD. So have you checked if patient has taken steroid inhalers in the morning?
We have not checked that, but we'll check this right away and I will get back to you. Yeah.
So what would be the maintenance steroid that you would take care of?
Well, in that case, as the patient is using steroid for long term, we will start by giving an bolus of IV hydrocortisone, 100 milligram as a theater. And then we will continue infusion of 200 milligram for 48 hours. And if the patient could start taking orally early as possible, we will shift to the oral dose and we'll double the dose. We should also maintain, we consider that this is a major surgery and the patient is critical. So there might be a need for continuous IV infusion of hydrocodone.
Good. You said you want to transfer the patient to ITU. What is the criteria which your patient fulfills in order to be transferred to ITU?
Well, in this case, the patient has chronic history of one systemic compromise, as she has COPD and respiratory compromise. She may need mechanical ventilation after the operation, and this patient is now at an acute system failure, as she has acute renal failure. So she has 2 system failure, and she needs 1-to-1 nurse-patient ratio monitoring and mechanical ventilation as well.
Okay.
Necessary.
If there is only one bed available and all of a sudden asthmatic young lady comes first, what would you do meanwhile?
Well, in this case, I will keep observe the patient in the recovery room, and I will wait until a bed is fixed.
Okay, right. Thank you. You can transfer the patient.
Thank you.